This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxia, and welcome to this special episode of Rural Health Leadership Radio. I'm excited to have as our guest today, Kelly Arduino with Wipfli. So welcome to the program, Kelly.
Thanks, Bill. Glad to be here.
Well, I'm glad to have you and glad to be talking to you about my favorite topic, rural healthcare, and the leadership that you provide in rural healthcare. So tell us about yourself. Who is Kelly Arduino? What's your story?
Oh, I've got quite a story, Bill. I did not start out my career in healthcare. I actually started it out in fashion. And although I really like the fast pace of it all, things just fall flat after a while. So I got myself into healthcare, and I'll tell you what, there's something changing all the time, and that's the exciting part of healthcare. I think it might even be cool now to be in healthcare, but it wasn't before when I was in it. But I love it, and I've had a variety of positions within healthcare, starting out as a psychotherapist and an academic researcher on how to change physician behavior cost effectively, a strategic consultant for a boutique firm that got bought out by a very large consulting firm, and then an investment banker learning all about healthcare finance. So I really feel like, this varied background has prepared me for the ever-changing, multifaceted environment of rural healthcare, where all of our people wear a lot of different hats. They have to be scrappy. And their job is changing all the time, and so I enjoy that challenge.
Yes, never a dull moment, that's for sure. But sometimes it's a little scary though too. But that's another part of the conversation, perhaps. So you've went from a career in fashion to now you're a healthcare industry leader with Wipfli, and I always hesitate on the name of that company, but I think I got it right, didn't I?
You did. It's unusual because Wipfli is actually a guy's name. His name was Clarence Wipfli, a Norwegian guy in Wisconsin that started the firm in the very auspicious year of 1930.
Oh, wow. That was a few years ago.
So, we've weathered a few ups and downs ourselves as a firm. We started out in Eau Claire, Wisconsin, and Wausau, Wisconsin, so deeply rooted in the Midwest, in rural settings, and we've serviced all kinds of clients in those small and mid-sized cities, not just in healthcare, but in car dealerships and banking institutions and construction real estate. And really that is our roots. Probably about 80% of our clients are in a rural area of some sort.
Okay. So why did you choose to focus on rural healthcare yourself?
Well, I actually grew up in a small town. We had a blinking red light, a post office, and a general store.
All right. Big city.
And yeah, big city. We were about 9 miles from the town where I actually went to school. And so it was, a pretty long bus ride in those mornings. You drove about 45 minutes to get to school because it took so long to pick all the kids up. So I really do, understand that life and appreciated it. In our small town where I actually went to high school, they did have a critical access hospital, which of course is a mainstay of rural healthcare. And that was really important growing up, not just because it was a great source of economic support for the community, but personally, I went water skiing. I'm not that coordinated. I fell and the water ski hit my nose and I broke my nose, and the week before school started, I ended up in there. Another time, my sister and my mom were playing softball out in the backyard. You'll probably get the idea that we're not the most, physically coordinated family.
Okay.
But she hit my mom, in the jaw accidentally. And again, that would have turned into a 35 to 45-minute drive had we had that hospital. So really that importance of emergent care in the local communities really spurred me on to be an advocate for rural health.
Absolutely, because sometimes that additional drive can be a life or death situation. That's for sure. So that's great. So Kelly, as you know, the name of this program is Rural Health Leadership Radio, and I emphasize the
Mhm.
word leadership. So what's your definition of leadership?
Well, I wrote this down. I'm gonna use my notes for a second because I thought, oh,
Okay.
this was a good thought because it really is important as a leader that you are empowering others. It's not about you. It's not about what you're doing. It's about how much you can get out of everyone else in terms of helping them realize their potential and then helping them push forward, push the envelope beyond what they maybe feel comfortable doing. So that's really what I see the role in. And in rural healthcare, especially now, maybe we'll talk about this later, we're in a very pivotal time where we need leadership to think, how are we going to do healthcare and specifically rural healthcare moving forward?
Absolutely. And I like the way you included pushing the envelope in your
Hmm.
definition there, because sometimes it's easy to get set in our comfort zone, right?
Yeah,
And
absolutely.
as a leader, if you want things to improve, things have to change. And that sometimes that means pushing the envelope. So thanks for sharing your definition with us. So you told us a little bit about Wipfli and your vast array of business, but most of it sounds like is focused on rural America, regardless of the
Hmm.
industry. Could you talk a little bit more about the services that you provide in rural healthcare?
Sure. So are what we call a full continuum of services. You may know Wifley as an audit and tax firm, and everybody needs that. Sure,
Yes.
we get it. But the real key, I think, to helping our clients and why I think we've been successful is that we have a big array of services because it's more than just audit. Um, but it is an underpinning, financial stability is an underpinning of being able to continue to provide those services. So we help with all types of things like making sure you're getting adequate reimbursement, maybe making sure in terms of revenue cycle, your billing and collections are as efficient and accurate as they can be. Helping people think about expanding their business. What new services do they need? What's the financial impact of those services? Do they need to invest in facilities? If so, how large? How much is that going to cost? How can they access capital to be able to afford these investments? What kind of interim services might you need if you're having succession planning or an abrupt departure of one of your leadership? So it really, Bill, it really runs the gambit. I'm really proud of Wipfli because, you don't have to go to one of the large big firms that may not necessarily understand healthcare to have that more holistic perspective of all the components that really affect the bottom line in your organization.
Yeah, yeah. What you said at first. You're known for your auditing services, and that's how I know you guys. So I'm glad
Hmm.
to have a better understanding of it's much deeper than that. So thank you. Plus, I know that when I was looking at meetings to attend back when we used to have meetings in person,
Right?
I think I saw that where you guys have some kind of an annual conference, or maybe it's a regional conference for healthcare leaders.
We do. We have both rural health clinic conferences as well as conferences for critical access and rural hospitals
Okay.
specifically.
Mhm.
Again, targeting that niche, those issues that are specific to those kinds of organizations. We're rethinking that this year. We usually have two conferences in the fall, one in Reno and one in Minneapolis. Our Reno, we're pushing back and we're rethinking, probably just like NRHA, how do we reach out, provide the education that people need, provide the networking that people need. So that's kind of a work in progress. And then we're hoping that maybe our Minneapolis conference will be able to go forward. It's usually a smaller conference, a little more intimate, maybe less than 50 people. So,
Okay.
we'll see. But again, we're going to explore, much like I think everyone else, either
Yes.
dual tracking of virtual or some other method of making sure we can provide the things that I think are really important is when people can get together.
Yes, and I think that when people can get together, there's going to be a big surge of attending those. But it's great. You're spot on. We can still deliver the things that people need to know virtually as well. So thank you for sharing that information with us. what about the COVID-19 pandemic? I mean, it's turned everybody's world upside down. I'm sure it's had an impact on Wipfli. What's going on as it relates to the pandemic?
Well, like I tell my non-healthcare colleagues at Wipfli, healthcare has always been special, and with COVID, it's even more special.
Yes.
They often say, "What what's so great about healthcare?" And you guys think you're just a sovereign nation, and I said, "Yes, we are. Not only are we unusual in terms of everything that happens in COVID, we are literally life and death here. So the clients that we help serve, that is an essential part of what we do. We probably, like everybody else, scrambled. I mean, recognizing that we're primarily financial, meaning we help make sure all the financial processes, planning, et cetera, run smoothly. We knew that we weren't the most important people. Everyone was looking at logistics and just getting supplies they need and just trying to react to all the changes. So we launched what we call our financial recovery services, knowing that when people came up for air, even just a little bit from providing services, that the shutdown of elective surgeries would likely be devastating. We had an inkling that there would be funding, but man, we did not see the deluge of all the various funds that came into the healthcare organizations. Many of our rural organizations actually are flush with cash in
Right.
comparison to where they were before, but that doesn't mean that it doesn't come without strings. And so, we're helping understand, what do you do with this money? How do you account for it? How do you spend it appropriately? How do you make sure that you're complying with all the guidelines that frankly are still evolving?
Right.
So we started with that, and we're still in that, and we will be for quite a while. I just heard there's a maybe 30 billion for infrastructure coming out, which to me launches into the next phase of what we need to do, which we call healthcare reimagined. Um, this is an opportunity, as we said, to change how healthcare can be delivered in the rural. I mean, I was just thrilled to see the changes with telemedicine and
Right.
reimbursement. It was certainly long, long overdue. But if this is also an opportunity to invest in infrastructure that can really truly provide increased access to care in a virtual world, right? Whether
Yes.
that be drive-through testing, whether that be better broadband in our rural communities, whether that be even regulations or changes around, freestanding ICU, OB, et cetera, more separation. Um, those are going to be essential changes, I think, that rural will have to make. We spent a long time in rural healthcare trying to be as efficient as we could, having the smallest building because it's so very expensive to have a building, making sure your nurses stations share with multiple different units. Now it's different. How do we really interact with our customers? That's been kind of in the background for a while,
Yes.
customer, patient, etc. But I mean, man, did we all get a kick in the butt around that, and the need for, I think the need for doing it really well has been catapulted to the top priorities of what rural leadership should be thinking about.
Yeah, and if we go back to your definition of leadership and pushing the envelope,
Hmm.
that's a time to do this. And the good news is there's actually money in that envelope now too. But you got to be careful with that because I know some CEOs that I've been talking to are afraid to spend some of that money too.
Yeah,
Um,
they are, and that just goes to the integrity of our rural leadership, and maybe they said this before, but I mean, we had calls from people, Bill, who said, you know, several millions of dollars just showed up in our account, and I
right.
don't know where it even came from.
Yeah, yeah, that's crazy.
Um,
Interesting times, that's for sure.
yes, worse problems to have, but I'm excited for what possibly it could do to help again catapult rural into better access to a widely distributed population that doesn't always have access to care.
Absolutely. So, can you talk a little bit more? You talked earlier about rural health being so important to your organization. Can you talk about that a little bit more? Why is it so important?
Well, it really is kind of the mainstay for who we are. A lot of people frankly can't pronounce the name Wipfli. It's an unusual name. They think of us as an accounting firm. And honestly, Bill, the reason is because we don't do a lot of advertising. We're not, out there putting up billboards. We're really kind of a heads down, hardworking, do whatever's best for your client organization that I think mirrors a lot of the values that we see in rural communities. And so we recognize that we're not going to be, the top 5 accounting firm in the United States, and that's okay. And we're not going to work with probably, the Ascensions of the world, the largest healthcare systems, although they're free to call on us if they want some help with rural healthcare.
Sure.
But really, the deep expertise and the nuances of how you provide care in that setting is just really what is our focus now and going forward.
Well, speaking of that, if a hospital CEO or a rural health leader is looking for an outside source to provide the type of services that Wipfli offers, can you give us some guidelines of some of the top considerations they should take into account before choosing a firm?
Sure. And I think I'm really glad that you asked this question, Bill, because it is an important one. Sometimes we respond to RFPs and we just want to say, maybe that's not the right question you want to ask,
Right.
because we really want you to get the best person or organization. It's not always us. There's other providers out there that are good, that understand things, especially in the rural space. But I think one of the key questions is a deep understanding of what your expertise is in rural healthcare. You just cannot apply the same kind of metrics, the same kind of expectations to a rural healthcare as you can to, a large urban setting. And so, understanding that level of expertise is one of the most important things. The other thing that I think about too is, who actually am I going to be working with on this project? I mean, some of the things we talked about, service expansions, investing in a new facility, revamping your revenue cycle, looking at your succession planning. These are, or, I forgot the 2 other, I'm sorry, I gotta back up a second. There's 3 big things that you can do in rural. One is, what's your electronic health record? The other is partner or not partner, and so, if so, who? And then the third is, a major kind of facility investment. When you are making one of those 3 decisions or some stepwise of those, you want to make sure you're working with not the new consultant who just joined the firm a few weeks ago, or even, someone that maybe does healthcare and then they do banking and then they do some other industry. You really want senior people who have seen the industry evolve, know where it's headed, and again, can help the leaders challenge themselves on pushing the envelope. So I think senior level involvement from your firm is a really, really important piece, in addition to the kind of the rural expertise. And then the other thing is, I think it's important to kind of understand the flexibility of that firm. Sometimes I know governmental RFPs come out and they're pretty strict, but if there is a way to have some kind of interaction with who you're going to work with, so often you start a project, especially of the magnitude we talked about, and things go in a different direction, and you can't just follow the scope. Boom, boom, boom. Here's how we laid out in the RFP. It's necessary to have some kind of change, and you want to feel comfortable whoever you're working with is capable of making that change, is fair when you do make that change, and understanding the flexibility of the firm is another key piece.
Sounds like some great advice in making that decision. In fact, it sounds like Wipfli, that's a big part of what you do, is you provide data points to help rural health leaders make decisions. So it's right in alignment with your sweet spot there. So I know you've worked with a lot of rural health leaders, because the way I heard about your company is one of my client hospitals, which is a critical access hospital, but you utilize your services. So can you share with us maybe some best practices that you've seen rural health leaders apply? I know we like to share best
Sure.
practices here on Rural Health Leadership Radio. Do you mind sharing some?
Well, I think that this is a cornerstone of Wipfli, and I think it's an important one. But in terms of best practices, when you're making large decisions, and it may seem very, very simple, but we often see situations where people are planning for something major, whether it's an expansion of a service line, whether it's a new clinic, or we're kind of past the new hospital phase, but some kind of big investment, and they kind of get excited about and the staff about that change, but they don't incorporate the financial implications of that change from the very beginning. And when we're talking about planning for the future, it's kind of you start up here, and you have some kind of concept ideas, and maybe you have, but you also should have some kind of understanding of high level financial implications. And as you move down the planning continuum, you can refine both those, but you don't want to get this one so far down the road that you find yourself in a situation where, oh gosh, we don't have the money to invest in this need, or we don't have a plan for that. So I think a real component is not using financial position as a limiting factor, but a consideration, and then think, okay, well, how can we get this money in? What other sources are there? And that needs to be parallel to whatever you're thinking about doing and investing in.
That makes sense. That makes sense. So, can you tell us about one of your clients
Sure.
who you've worked with that your services really benefited, to give us an idea of the impact you can have?
I thought about this one long and hard, Bill. It was difficult to choose, and I did a little poll among my other partners, and I said, hey, who should we talk about in this question? And the one we came up with was Midwest Medical Center in Galena, Illinois. They actually were, if not the first, one of the first critical access hospitals to ever rebuild in 2006. Back
Okay.
then,
Yes.
that was when uh, the whole in the larger world of finance and capital access, people didn't even know what critical access hospital meant and what
Mm.
the implications were. So we became involved with them a little after they built the new facility, and we kind of realized that some of their early planning was maybe a little overzealous. They didn't quite have the dollars that they needed to be able to support the debt, and 2008 we had the recession. So we helped them again continue to plan for, well, how do you basically right size where you're at right now? What is your plan for recovering from where you're at? We interface with their bondholders, who on many, many occasions probably would have liked them to just, shut down. We were there with them when they had a number of suitors that might think about buying the hospital, but never kind of came to fruition. We helped them think about what they did with one of the empty wings that they had that was not full. We helped them with their contracts with their physicians, and the struggles that they had, because some of the physicians in town had their own insurance plan, and that plan was not covered at the critical access hospital. Um, and we saw them over time just kind of gut it out and help them, make those big payments on their debt that they were really struggling to afford. And I guess the crowning achievement probably was at a point in time when the market was good, we were able to help them refinance their debt through USDA. We did the feasibility study. We helped with the application, and got them from a very high interest rate to a much reasonabler um, rate that they could afford, and freed up dollars. So now they are engaging in a master facility plan and rethinking their campus on, now how do we prepare for not even a post-pandemic world, but perhaps a pandemic world that cycles through for a while. So I'm really just touched by being able to see the journey, to be able to be with a client through the difficult times, helping them, kind of financially eke through. I think that's a real staple of rural. We got a lot of scrappy people who, have for no fault of their own, and a lot of times, been in difficult positions before, factory closes in town, what does that mean? And just, pull all the stops that we can out to make sure that they're financially viable and have a path toward the future.
Yeah, that's a great story. Thank you for sharing that with us. Sometimes it's a bunch of small steps that lead to those big accomplishments. So thanks for sharing that with us. So Kelly, you've seen a lot of things take place in rural healthcare. What scares you the most about the future of rural health?
Well, what scares me the most, we'll see if it changes, but we've seen a lot of for-profit or private equity investment coming into healthcare and basically pulling out some of the very profitable pieces of healthcare, the things that really support some of the other not so profitable but very necessary things in healthcare, like ICUs, like OB-GYN, like basic primary care. And so if that march continues where we see, for example, knee surgery only just pulled out of the rural hospitals, um, and or just kind of standardized repeatable care that again keeps the connection with the patient, then what would be left at the hospital? If it's only acute care, emergent acute care, that's a really tough business model to be able to support. And that will threaten the sustainability of some kind of inpatient care in a lot of our rural communities. So
Yes.
that's my biggest fear.
Yeah, understood. Yes, that is scary. So let me flip that question around. What excites you the most about the future of rural health?
Well, game changer, right? I mean, COVID actually has been a positive for many of our rural healthcare organizations. So I guess the silver lining analogy is certainly true. And, this is a time for transformation, for really, accelerating the things we've talked about forever. I mean, how long has telehealth been around and telemedicine? It's been around for 10 years plus in
Right.
some, right?
Some
And
form or
and
fashion.
now,
Yeah.
and everyone just flipped and did it to the best of their abilities, right? Good,
Right.
bad, ugly, they did it out of necessity. Now it's time to really refine that and expand that. And so I'm really looking forward to a renaissance in rural healthcare. I think this pandemic has made people understand the importance of rural, not just in the rural communities. I think we always knew that.
Right.
But I think politicians and legislatures perhaps now are aware, and as that kind of pull away from needing hospitals in small communities, which had been the trend previously, I see that reversing, and so I think now we just go for it.
Yes, absolutely. And that's exciting. That's for sure. Well, I can't believe how quickly the time has flown by, Kelly. If our listeners only take one thing away from our conversation today, what should that be?
Well, I'm here to represent Wipfli and rural healthcare, and I say that we are a real advocate for rural health. We have a full continuum of services. We deeply understand it. We'd be happy to help you and have a conversation. And if we can't help you, we'd be happy to refer you to someone who can, because again, rural health is our mainstay, and I think that rising tide lifts all boats, and we're there for you.
Kelly Arduino, healthcare industry leader with Wipfli. Thank you again for being with us here today, sharing your knowledge and expertise.
Thanks, Bill. Appreciate it.
If you would like to connect with Kelly or anyone on her team, or just learn more about Wipfli, you can look at the notes underneath this video. We'll have the contact information there. You can always check out their website. It's pretty simple, wipfli.com. That's WIPFLI.com. And if all else fails, you can reach out to me and I'll be glad to connect you with Kelly as well. If you'd like to subscribe to Rural Health Leadership Radio, hey, if you got a smartphone, check out your podcast app and search for Rural Health Leadership Radio and hit the subscribe button. Or you can also check out our website at rhlradio.com. If you enjoyed today's episode, this special episode of Rural Health Leadership Radio, maybe something Kelly said or something that piqued your interest that Wipfli can provide, please let us know. And maybe you know someone else that might benefit from our conversation. If that's the case, please share, because we're all here to serve you. Until next time, let's keep working to improve rural health, one conversation at a time.